Hello friends, welcome to my YouTube channel. Today we are going to learn the Norma Occipitalis. When the skull is viewed from posterior aspect, it is known as the Norma Occipitalis. Let us see what are the bones visible on the Norma Occipitalis. So we can see two parietal bones, we can see the occipital bone, and again we have the mastoid process. We can see the mastoid process here. What are the sutures visible? We can see the posterior most part of the sagittal suture, and we have the lambdoid suture. This is the lambdoid suture. If we see here clearly, you can see the lambdoid suture, or this suture separates the occipital bone from the parietal bone and occipital bone from the temporal bone. This is the mastoid process. Mastoid process is the part of the temporal bone. Okay, suture which is present in the occipital bone and the parietal bone, this is known as the parieto occipital suture. Parieto occipital suture, and the one which is present between mastoid process and the occipital bone is known as the occipito-mastoid suture. Occipito-mastoid suture. Occipito-mastoid suture. If we see this occipito-mastoid suture, there is a foramina known as the mastoid foramen. Mastoid foramen is located near the occipito-mastoid suture. This mastoid foramina. So the mastoid foramina, what structure is passing through the mastoid foramina? That is the meningeal branch of occipital artery. Occipital part, we have the occipital artery, which is a branch of external carotid artery. So the meningeal branch of occipital artery and emissary vein are passes through this mastoid foramina. Mastoid foramen. And another important structure which is present on the Norma occipitalis is the external occipital protuberance. External occipital protuberance is a protuberance which is present on the occipital bone. This external occipital protuberance marks the junction between head and neck. The area above is the head and area below is the neck. The point on the external occipital protuberance is known as inion. Here we have the external occipital protuberance. From the external occipital protuberance there arises one line that is known as the superior nuchal line. Superior nuchal line, and below we have inferior nuchal line, and there is one more line that is known as the highest nuchal line. So here we have the superior nuchal line, here comes the inferior nuchal line, and this is the highest nuchal line. Let us see what are the structures attached. The medial part of this superior nuchal line gives origin to trapezius muscle, whereas lateral part gives insertion to sternocleidomastoid. So medial part, that is the medial 1/3, gives origin to trapezius muscle, and the lateral 2/3 gives insertion to sternocleidomastoid muscle. Just below the insertion of sternocleidomastoid, below there is the origin of another muscle that is known as the splenius capitis. Splenius capitis. The one which is above is known as the highest nuchal line. This highest nuchal line gives attachment to epicranial aponeurosis. The medial aspect of this highest nuchal line gives attachment to epicranial aponeurosis, whereas the lateral 2/3 gives origin to occipital belly of occipitofrontalis muscle. So here we have the external occipital protuberance. Extending from the external occipital protuberance, so here is the foramen magnum. There is a crest. That crest is known as the external occipital crest. You can clearly see the external occipital crest over here. This external occipital crest gives attachment to ligamentum nuchae. Remember, external occipital crest gives attachment to ligamentum nuchae, which is a strong ligament which is present on the posterior aspect of the neck.